practitioner is a type of medical provider. So I fill a role that is very similar to a doctor or a physician's assistant. So basically I see patients all day. Some of them are healthy and I'm seeing them for well checks, and some of them are sick, like they have a specific concern. So basically I listen to what they have to say. I conduct a physical exam. I decide the appropriate tests and labs to order. Then I come up with a diagnosis, a treatment plan, and then I have to educate the patient and the family on that treatment plan. I also spend a lot of my day collaborating with other medical providers, and I also do a lot of delegating to nurses and medical assistants. I have two things that I really love the most about my job. The first kind of obvious one is helping people. And especially since I work in pediatrics, I'm helping kids. And the thing about kids is they don't want to be sick. They don't want to be sick and not get to go to the class party. They don't want to have a cast on their leg and they can't go out and ride their bike. So you want to get them well and they want to get well. So in that way, you're like a team working towards the same goal. And I love that I can diagnose strep throat and know that if I start them on an antibiotic, they're going to feel better within 24 hours. So I like fixing them, which is great. And then the second part I would say is that I have always loved solving mysteries. And I always say that every exam room I go into is kind of like a new mystery, because I have to pick up on clues, listen to what the person is saying. Then I have to gather more clues when I do my physical exam. And then at the end, I have to put it all together like a puzzle or a riddle that I have to solve. So it's kind of like solving mysteries all day, which is cool too. Challenging part of my job is taking work home. And I mean that both literally and figuratively, because in medicine, you are often taking home charting, billing, paperwork, things like that. But also just figuratively, if it is a tough week where there was a cancer diagnosis for one of your patients, or you had a really depressed teenager or something like that, it can be difficult to turn that worry and that concern or that sadness off at 5 p.m. And just gaining lots of experience as a nurse first, and then going back to school to get the master's degree. A huge part of that master's degree was the clinical hours. And you want to get good clinical hours in diverse settings so that you're very well prepared to treat kids or to treat pregnant women or to treat the elderly or whatever. And actually those spots can be really hard to get. There's usually more students wanting them than there are people that are willing to precept and teach. So I wanted to share this because I feel like it's applicable to a lot of different areas. But the pediatric setting that I wanted, the doctor initially turned down any students for the semester. And I printed up my resume. I showed up unannounced in his clinic. I gave him my resume with a big smile, and I kind of insisted that they consider me. And within 24 hours, I had gotten a call back that he was willing to take me. So I spent my whole semester with him, and that's actually who wound up offering me the job. Wound up hiring me, but of course I was going early, I was staying late, I was really trying to go above and beyond because I really liked it there. And I feel like people in different careers need to know that sometimes you don't take no for an answer, and sometimes you have to be a little bit assertive to get what you want.